Hello everybody and welcome to our webinar, and a particular welcome to those of you who've been with us before, and also a warm welcome to anybody who's joining us for the first time. My name's Joanna Clark. I'm the Director of Deaf Child Worldwide based in the UK. Today I'm really delighted to say we're going to hear from speakers in Zimbabwe, Uganda and India. And they will be talking to us a bit more about the ways in which the COVID-19 pandemic has affected deaf children, particularly in relation to their education. And then discussion after that will sort of focus on what we can learn from these experiences, and we can hopefully start a bit of the discussion to think about how what we've learned from the COVID pandemic might help us to design more inclusive education for deaf children in the future. I've got 4 international sign interpreters with us today, Lisa, John, Robert and Marsan, and they will be on screen for the whole of the main part of the presentation and the webinar. They won't be with you in the breakout room, but they'll be here for the rest of the time. If you need to know how to pin your interpreters to the screen, please have a look in the chat box and we'll put some instructions up there. We also have live captions in English. And if you press the CC button on your screen, I think usually it's at the bottom, you can follow that link or have a look at the link in chat. I would ask you to keep your cameras off and stay on mute whilst we're having the presentations, and there will be an opportunity later to join a breakout group and switch your cameras on and actually have a bit further discussion about some of the issues. Just to clarify some of the terminology and the terms we will be using, obviously, we will be referring to deafness. And when we refer to deafness in this context, we're talking about all levels of deafness. So mild, moderate, severe, and profound deafness. I know there are different terms used in different countries, but that's what we'll be using here. And when we refer to language, we are referring to both spoken and sign language. We don't mean one or the other specifically. Also, we will be talking quite a lot about education today, and obviously inclusive education is key in how we include how deaf children can be better included in the education system. But we're talking about inclusion no matter what sort of school a child goes to. So a child can, for example, be excluded in a school for the deaf for many reasons. So inclusive education refers to all types of schools that the deaf children might go to. So before we get on to the real substance of the discussion about what's going to, the impact of the pandemic on deaf children, you can see here the agenda. I just want to give a little bit of background about what deaf education has been like for deaf children before the pandemic. I think there's always the temptation to say we want to go back to how it was, but I think most of us who worked in this field know that we don't want to go back to how it was because it wasn't great before the pandemic. I mean, sadly, we know after Deaf Child Worldwide sort of 20 years experience of working in a number of countries that a lot of deaf children never actually get to school for a whole host of reasons. And time and again, our partners and others in South Asia, East Africa and elsewhere have told us that they've identified children who do attend school, but really are very unable to get very much out of it because the teaching is not made accessible for them. And deafness
So although deafness isn't a learning disability, education often isn't accessible to deaf children because they don't have the right support in the classroom, and maybe they haven't got the right support elsewhere either. And this support has to include helping deaf children to develop language skills at an as early a stage as possible. Unfortunately, in many places, and particularly in low-income communities, late diagnosis, lack of support infrastructure, lack of understanding about deafness, and quite a lot of stigma means that children are often very late in learning language. And we do know from some of our research that about 80% of children who do get to school arrive at primary school with little or no language, and that many are 6 to 10 years behind their hearing peers in their language skills. So this was, broadly speaking, the situation before the pandemic. Obviously, the pandemic itself has compounded some of these issues, but we'll also be looking later on at perhaps some of the things, more positive things we've learned from this. But just before we get onto the presentations, I wonder if all of you would like to just use the chat box and just give a word or a sentence on how you think the pandemic has affected deaf children in particular. It's affected everybody, but how has it affected deaf children in particular? Have you got any thoughts on that to perhaps just put it in the chat box, and I'll give you a minute or so to do that. Okay, there's some really interesting points coming up here, and thank you all very much. I hope you're all looking at the comments that people have made, because they're all, unfortunately, all of them, I think, are extremely relevant. And obviously, when schools have been closed, in some cases for 2 years or more, it's had quite a major impact on, as we said, all children, but particularly some particular impacts for deaf children. And from the feedback of our partners, I mean, we would agree with everything that everybody has put in the chat box. And we did, with some of our partners, do some research in West Bengal. We've also been in touch with all our partners in East Africa and the rest of South Asia. And certainly sort of 3 of the key things that probably encompass a lot of what you have said is the loss or stagnation of language learning, which, you know, again, we can't overemphasize the importance of the need for a deaf child to learn a fluent language. And being at home or not being able to meet with other sign language users or other peers, often language has deteriorated. As a lot of you mentioned, the education was inaccessible, partly because of it being technology that wasn't accessible, but also because a lot of the online or TV education didn't have subtitles, just wasn't accessible in so very many ways. And we talk about sort of social behavioural problems. It could be sort of mental health issues, which a number of you have raised, because of, again, being cut off from meeting friends, meeting peers, going to school, has had a huge impact. And deaf children are often very isolated anyway, and this has just made the whole situation that much more challenging for them. Now, I'm not going to talk any more about that, because I'm very happy to say we have got 3 video presentations coming up. I'll introduce each one as they come up, and the people presenting will talk to you a lot more about what they have witnessed and done during the pandemic. I should say the presentations are all from local NGOs or community-based organisations in the different countries. And I think what did come out of everything we saw was how important these organisations were during the pandemic everywhere, and what a hugely important role they played. So without further ado, I will introduce our first video presentation. And this will come from Zimbabwe, if we just wait a moment. This will come from Zimbabwe, from the Nzeve Center, and Lynn Dirikwe from the center, and her colleague also, sorry, I beg your pardon. Lynn is the coordinator in the center, and is also the parent of a deaf child who goes to the center, and she will give her initial thoughts on what they have learnt there. So please sit back and enjoy the video.
Nzeve is a family-centered organization which works with deaf children at an ECD level together with their families, where they learn communication skills. The activities are planned in such a way that they learn together, parent-child pairs, which is very important for the family as a whole, because as they go back home, they can communicate and also teach the other family members in communication skills. Most Zimbabweans have got cultural beliefs about deafness and misconceptions. For instance, most of them just think about witchcraft. Deafness is as a result of being cursed by God. So by so doing, they delay in identifying, they delay intervention. That's the problem. Because of that reason, there's a lot. The Nzeve does a lot of deaf awareness, outreach in the communities, gathering the community members and teaching them on deafness issues, so that the children are identified at an early age for early intervention. Children needs, their unique needs are language, which should be presented visually. When they learn, they need things to be presented visually, unlike the hearing children. They cannot learn things, there's no incidental learning like hearing children, where hearing children can learn through overhearing things from other people, whereas children have to be taught visually, giving them information visually. That's the difference. The way addresses by presenting every activity visually, with drama, role plays, drawing, giving pictures, and even taking children to where things are happening so that they can get to know. When the first lockdown started in 2020, this really disrupted the whole program of the ECD Center. The children had to stay at home. Some of our children come from out of town where they had to travel. So there was no traveling. They stopped coming together with their families. So there was no continuous learning. So what we had to do as an organization was to prepare the home learning materials knowing that the deaf children forget easily. So we wanted them to continue getting some form of learning through home learning activities where we delivered them. We could identify some central points where we distributed home learning materials. The challenges were sometimes to communicate with the child, the parents through WhatsApp group. We created a WhatsApp group, but not every parent had a smartphone to communicate and give feedback about progress of their children. So it was a big challenge. For such parents, we had to drive and try and locate them and visit them and distribute home learning materials. Now, for many of them, their sign language had deteriorated because of lack of one-on-one teaching, face-to-face teaching, which we used to do. Even though we had to distribute home learning materials, it wasn't a daily thing. Some of them were to leave them and see them the following month, so it was not very, very, very close. So there was a difference. Some of them had deteriorated. We hope that the children do excel, do acquire sign language skills together with their families, so that they are not left out in whatever activities within their communities, so that they are included. If ever they acquire the language, they will be empowered enough and they will be having information in their communities.
Mai ane mwana asinganzwi nekutaura. Mwana wangu mukomana ane makore 6. Inini ndakauya panzeve kuzodzidza nemwana wangu ndinora gore rechitatu ndichiya nemwana wangu kuzodzidza pano panzeve. Tine rubatsiro rwatinowana panzeve rwekuti tinodzidza pamwe chete mai nemwana mahara. COVID-19 payakatanga ndogore randatanga nemwana wangu, saka zvakanditasisa kuti ndiwane dzidzo nemwana wangu. Tikaenda kumba tikanogara. Patakazodzoka nemwana wangu kuziva mutauro papasisina, because tatichangoya tichidzidza nguva shoma shoma, COVID ndobva yazotanga. Saka patakazodzoka kuya kuchikoro nemwana wangu, takawa nenguva yekuti tiri mukilasi tinenge tichipiwa mahomework tichidzidzawo pamwe nemwana, tasvikawo kumba tichibatsirana nemwana homework iya, nokuti taakudzidzawo zvinenge zviri nani. Inini mwana wangu ndinoshuvira kuti dai apedzawo chikoro akura oitawo kosi yaanoita kuti azokwanisa kuzviriritirawo, agokwanisa kuzozvichengetawo iye pachezvo.
And thank you very much to Joyce and Makudze as well for telling us their story. I think this was just before we go on to the next presentation, I think just hearing from the centre in Zimbabwe, and Lynn is the families coordinator, and I think that says it all. The centre works with young children and with the families, and working with the families is so important. And clearly the centre has done a huge amount during the pandemic, but also before and is continuing to do so. So thank you very much for raising those issues and telling us about your experiences. I think our next video presentation will come from the National Association of Parents of the Deaf in Uganda. NAPADEC, who is a long-time partner of Deaf Child Worldwide. And we're very happy to hear from Harriet. Very pleased to hear from Harriet Ageno and Bayan Ferdinand. Harriet is the project coordinator of the program working with deaf children and families. And Bayan is a sign language instructor who also teaches sign language to parents and deaf children. So we're looking forward to now just hearing their presentation.
We had both positive and negative impacts. The biggest challenge, schools were closed. And when schools were closed, the positive part of it that parents had to have opportunity with their children to do parental guidance and counseling. And then also to teach their children homework, like maybe a basic activity, like maybe washing clothes, cooking, life skills, and then counseling. Then also, like to the youth, deaf youth, when they came back, they were involved in income generating activities, which developed their skills. They were able to explore their skills. But the other negative part of it, when schools were closed, the schools were closed when parents and children were not informed. You know, just from nowhere, and then the government communicate that tomorrow we are closing schools, and then the schools were closed unaware. The deaf children were not aware. So psychologically, they became tortured because they didn't know what was happening. But as NAPADEC, we kept on doing home visit to follow them up, and then made phone calls to reassure them that it is COVID-19 pandemic. That's why everyone is at home, not only deaf people. But when the situation calms down, children will be going back to school. And then the other effect on it that we had recorded, Uganda recorded the highest number of teenage pregnancy. We have this in record. Many young girls drop out of school and they couldn't go back. And then a case in example where we were, the districts we work like in Higa girl was just to produce. It was as a result of COVID-19 and she couldn't return back to school. We have many cases reported in record of teenage pregnancy. And then also there was early marriages due to condition that the young girls were suppressed to, parents forced their children to get married, including the deaf children. And then also during the COVID-19, since we are doing family sign language training or learning, there was total close down in 2 shifts of the learning. Like last year, it was for 3 months, where there were restrictions and people couldn't move. But during this time, we couldn't do training because movement was very difficult. So this kind of made people to lose, because parents could not come for training, children could not come for training, and then the new parents, they couldn't sign, they couldn't communicate.
During the COVID time, when schools were closed for nearly 2 years, it had both positive and negative impacts. For example, from the positive perspective, when schools were closed, the parents and their deaf children had enough time to stay at home to learn from one another. That is in communication. There are those who had missed sign language communication from school. At least they attained this from families. So children and their parents were united together. But however, on the negative part, when schools were closed, it has caused most deaf children or other children in general to grow older than the way they were. Like before lockdown, you will find out that some girls had no breasts. Their size was not very big, they were still tiny. So now they feel ashamed. Someone will tell you, I am now grown up. They have breasts, and going back to classes like T2, it becomes too ashamed to them. You see, in Uganda, after 2 years, all children were to have a mandatory promotion. So now, this would mean most deaf children are complaining like they cannot manage the classes which they have been promoted to.
The experience of the children going to school, we have both positive and negative. We have a case scenario where the children, because the government gave instruction or passed a law that children should be given automatic promotion. So when these children were given automatic promotion, some of them are saying it's hard for them to catch up with the current class they are in. They miss their class. Like a case in Center High School when we visited them, they used to perform very well. She used to perform very well in P4, P2, but now that they have shifted her to a new class, she's getting it very difficult to catch up, and then our performance has deteriorated. Then when you ask them, they say that it's very difficult for us to understand my teacher. I get it very difficult to learn. And then some of the signs, they have forgotten some of the signs. And then some of the interpretation, we are not getting it well because the school is not purely for the deaf. We learn with the hearing children, and then we use interpreters. So some of the things, sometimes we don't get the interpretation. And then also, as Vian was saying, that some of them outgrown their classes or their ages. They look so big for the class they're in, and then they're getting intimidation and abuses from other pupils. Look at this big one still in P3. Look at this one. So that kind of criticism is making them not to like school. But others, they are very excited to be back in school, and they say they miss school. And because in school, there's a lot of time for them to play during after, then they have a lot of friends in school who are deaf like them. So always association is very easy. So they find life in school is more sweeter than life at home.
We need to have sign language based training based in schools, so that at least we can see how children are working, how we can counsel the deaf children, how we can counsel the parents to the teachers to handle the deaf children now that COVID has been somehow eased. This we need to find out the challenges that they are going through within the school setting, and then work with the teachers. Yes, in some areas, they have no interpreters, so we need to make sure that they access information of what is happening. We are thinking, depending on the circumstances, if we can advocate and lobby for some, at least partners who can be in position to give the scholastic materials. I don't know if Harriet has something to add. Maybe in the other, currently, we feel that due to the high number of pregnancy among deaf children, they lack sex education or sex and reproductive health information. So we feel this is the right time we need to train them, either in the school-based setting. Then also, we need to train these deaf children about safeguarding. We need to empower them so that they can have confidence. They know what is an abuse. so that they can be in position to report, so that they can be in position to have confidence and say no to abuse. Thank you.
Thank you very much to Harriet and to Bayan for a really sort of comprehensive overview of both, you know, the positives and some of the negatives of what has happened during the pandemic. And again, the importance of the family, both in terms of support, but also in terms of maybe discouraging sometimes children from continuing at school, and clearly a big issue around dropouts and so on, and issues around automatic promotion, which I think is probably not unique to Uganda. Just before we go on to the next presentation or the next video presentation, just to remind you, as you're watching the videos, I'm sure there are lots of questions coming up in your mind. So if you have questions, please do put them in the chat, and we will come on shortly to a panel discussion where we will try to address any of the questions that you have. So please just start to put any questions you might have as the videos progress, and put them in the chat box, and we'll try and get to as many of them as possible when we have our panel discussion. So thank you very much, and thank you again to NAPADEC for a really good presentation. And now we're moving on to India, and we'll be having presentations from two organisations who again are both long-term partners of Deaf Child Worldwide. And the first presentation will be from the Children in Need Institute in Kolkata, and we'll be hearing from Sangamitra Dutta, who is the program manager, and also from Ajmira Khatun, who is a community worker and a deaf role model on the program. And the second part of the presentation will be from Mansoor Ali, who is the director of the Graham Bell Centre for the Deaf in West Bengal. So thank you very much.
School closure actually has developed a mental distance among the deaf youths with their hearing peers in the school and the school teachers. Now they are afraid whether they can compete with their hearing peers in the school, whether they can follow their curriculum again in the classrooms, whether they can mingle up with their peers, with their teachers, they can communicate without any disturbances. And now after 2 years, when they are going back to school, whether the school will accept them, this fear is also now coming in the mind of some deaf youths, and they are really not really suspicious whether they want to go to these general schools or whether special schools are the only solution left for them. Now the school teachers and special educators are requesting us to strengthen the support, strengthen the training, so that they can support the deaf children in an inclusive classroom environment. They are asking for the lesson adaptations, and they are asking for hand-holding support within the classrooms for some few months, which can strengthen their capacity so that they can continue supporting the deaf children. Particularly for the children in the higher classes, the situation is the situation for the teachers are much worse, because giving them new concepts on science, on maths has become a really challenge.
আমি শেখ মনসুর আলী, ডিরেক্টর গ্রাম হেলথ সেন্টার ফর দ্য ডেফ। বিগত 2 বছর যাবৎ করোনা প্যান্ডেমিকের জন্যে সমস্ত স্কুল কলেজ বন্ধ ছিল, যার ফলে ডেফ ছেলেমেয়েরা স্কুল কলেজ যেতে পারেনি, বাড়ির মধ্যেই বন্দি ছিল। তো এই ডেফ ছেলেদের যে এডুকেশনাল নিডস, যে 8-5টা সাধারণ ছেলের মতো নয়, এদের জন্য যে বিশেষ কিছু নিডস রয়েছে, যেগুলোতে লেসন অ্যাডাপ্ট করে পড়ানো, টিএলএম ইউজ করা, যেগুলো থেকে এরা পড়তে পারছিল না এবং স্কুলে যেতেও পারছিল না এবং বাড়িতে মন মরা হয়েছিল। আর 5টা বন্ধুর সঙ্গে এরা মিশতে পারছিল না। যে করোনা প্যান্ডেমিক এদের এই এডুকেশনাল জীবনে ভীষণভাবে প্রভাব ফেলেছিল। এরা বন্ধুহীন হয়ে গিয়েছিল, যেহেতু এদের কমিউনিকেশনের প্রবলেম। এরা স্কুলে গিয়ে বন্ধু পেত, সেই বন্ধুদের এরা পায়নি। এরা বাড়িতেই একা থাকতো এবং মনমরা হয়ে থাকতো। এবং এদের মধ্যে এই প্যান্ডেমিকের সময় অনেক বাচ্চারা ড্রপ আউট হয়ে গেছে, তারপর আর স্কুল যেতে চায়নি। অমনিটি তাদের কমিউনিকেশন প্রবলেমের জন্য তাদের মতো স্কুলে যাওয়ার একটা অনীহা ছিলই, সেই অনীহাটা আরও বেশি করে প্রকট হয়েছে এখন এই প্যান্ডেমিকের ফলে। অনেক মেয়েদের বিয়ে হয়ে গেছে এই টাইমে। তো এটা এদের এডুকেশনের খারাপই হয়েছে আর কি, ভালো হয়নি। যেহেতু আমরা গ্রামে কাজ করি, অতি দরিদ্র পরিবারদের সঙ্গে কাজ করি, গ্রাম অঞ্চলে ইন্টারনেটের কানেকশানের অবস্থা খুবই খারাপ এবং বেশিরভাগই এই গরিব বাচ্চাদের স্মার্টফোন ছিল না, যার ফলে তারা অনলাইন কোনো ক্লাস তারা অ্যাটেন্ড করতে পারতো না। কিন্তু আমাদের সংস্থা এই সমস্ত ছেলেদের যে হোম বেস সাপোর্ট দিই আমরা সিভিআর অ্যাপ্রোচের মাধ্যমে, সেইটা আমরা জারি রেখেছিলাম। সেই আমাদের উইকলি যে সাপোর্ট সেটা আমরা করেছি সমস্ত বাচ্চাদের, যার ফলে বাচ্চারা কিছুটা হলে এডুকেশনের সঙ্গে, লেখাপড়ার সঙ্গে একটু টাচে ছিল, অনেক টাচে ছিল। আর যে সমস্ত জায়গাগুলোতে কন্টেনমেন্ট জোন বা রেড জোন ছিল, সেগুলোতে আমরা কাজ করতে পারিনি। আর এই প্যান্ডেমিক সিচুয়েশনে আমাদের সংস্থা কোনো রকম বন্ধ ছিল না, আমরা কাজ করে গেছি। এবং সবচেয়ে বড় জিনিস যেটা আমরা দেখেছিলাম, এই প্যান্ডেমিকের জন্য ট্রেন, বাস, সমস্ত যানবাহন বন্ধ হয়ে যাওয়ার ফলে গরিব খেটে খাওয়া মানুষ এরা কাজ থেকে বঞ্চিত হয়ে গিয়েছিল, শহরে যেতে পারছিল না, কাজ করতে পারছিল না, তারা কর্মহীন হয়ে পড়েছিল, চরম দারিদ্র্যের মধ্যে তারা দিন কাটাচ্ছিল। সেই অবস্থায় আমরা আমাদের ত্রাণ নিয়ে, রিলিফ নিয়ে প্রত্যেকটা বাড়ি এই ত্রাণের কাজ করেছিলাম, যার ফলে তারা এই ছেলেমেয়েরা অন্তত খেতে পড়তে পেরেছিল আর কি ওই টাইমটায়। তারপর আস্তে আস্তে গভর্নমেন্টের যখন প্রোগ্রাম শুরু হয়, তখন তারপরে অনেকটাই তারা অবস্থা একটু ভালো হয় দিয়েছিলাম। এই প্যান্ডেমিকের সময় গ্রাম হেলথ সেন্টার বধির বাচ্চাদের জন্য অ্যাওয়ারনেসের জন্য একটি ভিডিও করেছিলাম সাইন ল্যাঙ্গুয়েজের উপর। করোনাকালে তারা কিভাবে সচেতন হবে, কি কি করবে, কি কি করণীয় নয়, সেই সম্পর্কে আমরা একটা ভিডিও করেছিলাম। আমরা জানি অনেক বধির ছেলে লিপ রিডিং করে, যার ফলে তারা মাস্ক পরলে সেটা করতে পারছিল না। আমরা লো কস্টের একটা ফেস শিল্ড বানিয়েছিলাম এবং সেইটা আমরা বিভিন্ন আমাদের বধির ছেলেদের দিয়েছিলাম এবং সেটা দিয়ে তারা শিক্ষাতে তাদের অসুবিধা হয়নি লিপ রিডিংয়ের জায়গাটা থেকে। তো এগুলো আমরা যেমন করেছিলাম, তেমনি পরিবারগুলোকেও সচেতন করেছিলাম, যাতে করে এই প্যান্ডেমিক সিচুয়েশনটা কীভাবে নিজেদের ঘাড়ে যত্নে রাখবে, যাতে করোনা মহামারীর মধ্যে প্রকোপে না পড়ে এবং প্রত্যেকে যাতে ভাইরাসের টিকা নেয়, সেটাও আমরা প্রচার করেছিলাম। এখন স্কুল খুলেছে, আমরা বিগত বছরে আমরা একটা স্কুলের, হাই স্কুলের বাচ্চাদের সঙ্গে কাজ করার জন্য এডুকেশন ডিপার্টমেন্ট থেকে পারমিশন পেয়েছি। আমরা ইতিমধ্যে সেকেন্ডারি এবং হায়ার সেকেন্ডারি পরীক্ষাতে ইন্টারপ্রেটিংয়ের কাজটা করেছি। আগামী দিনে স্কুলে গিয়ে ডেমনস্ট্রেশন করানো হবে, টিচারদেরকে দেখানো হবে যে তারা কিভাবে ডেফ ছেলেদের ইনক্লুসিভ এডুকেশন সেটআপে পড়াতে পারে, এটা আমাদের একটা উদ্দেশ্য রয়েছে। আমরা চাই বধির ছেলেমেয়েরা তারা শিক্ষা নিয়ে এগিয়ে যাক, নিজে কর্মদক্ষতা দিয়ে নিজের জীবন অতিবাহিত করুক, আগামী দিনের ভবিষ্যৎ ভালো হোক। গ্রাহাম বেল সেন্টার ফর দ্য ডেফ সমস্ত রকম সহযোগিতা করব এবং এদের উন্নয়নের জন্য যত রকম চেষ্টা, যত রকম সাহায্য সহযোগিতা দরকার আমরা করব। ধন্যবাদ।
Great, thank you very much to the speakers from CINI and from GBCD. Again, I think interesting to hear all these presentations from very different countries, but all have experienced some very similar issues. And that's really what we can now start to talk a little bit more about, and in particular to talk about what we might have learned from the pandemic that will help us in our future work. So I'm delighted to say we have got a panel of 5 people joining us to start the discussion. So please do, if you have questions, put them in chat so that we can include those in our discussions. But first of all, I will introduce our panel members. You've just met through the video Harriet and Bayan from the National Association of Parents of the Deaf in Uganda. So welcome to both of you in person. We've also met Sangamitra, who is actually the program manager for the Children in Need Institute in India, and she is also joining us live. And new to the panel, or 2 people that you haven't yet met, are Santanu Patra, who is the project coordinator at the Graham Bell Centre for the Deaf that you just saw in the last presentation from their director. And we're delighted to also have with us Selina Mlambo, who is the director of the, I'm going to pronounce it wrongly, I know, Nzeri Deaf Centre in Zimbabwe. So we're delighted to have you all with us, and thank you very much for joining us. And I think we'll now see you all on screen, hopefully. And again, I'll encourage everyone in the audience to put any questions up on the chat box. So in the meantime, whoops, just let me find you all again. In the meantime, I would just like to start by asking each of the panelists probably the same question, but I will ask each of you in turn. I think let's start on a positive note. We've heard a lot about all the really sort of quite the negative impact of COVID, and there's no doubt that there's huge negative impacts. But I think also for everybody, it's meant that we've all had to work a bit differently. We've all had to find different ways of supporting deaf young people and their families. And I wonder then, the question I'm going to ask each of you in turn is that sort of in relation to all the support you've been giving to deaf children, young people and their families throughout the pandemic, is there anything that you or your organization did or learnt that was new during the pandemic and that you will continue to do in the future? And I wonder if I could start by asking Santanu from GBCD.
সম্পাদি কেন এটা একটু ট্রান্সলেট করে দিতে হবে।
ওকে,
যেটা আমাদের কাছ থেকে সবথেকে শেখার জায়গা ছিল যে আমরা এই কোভিড সিচুয়েশনে যত তাদের মানে বাড়ি গিয়ে যে সাপোর্টটা দিতে পেরেছি এবং তাদের খুব ফ্যামিলির কাছে হয়ে গেছি, যে এটা নয় যে আমরা শুধু তাদেরকে এডুকেশন সাপোর্টটা দিতে আসি, তাদের আর যে সাপোর্টগুলো মেন্টাল সাপোর্ট থেকে আরম্ভ করে তাদের ফ্যামিলি প্রবলেমে আমরা সাথে ছিলাম। তারা এখন সেই সিচুয়েশনটা অনেক বদলেছে। তারা আমাদেরকে অ্যাজ এ ফ্রেন্ড হিসেবে তারা মনে করছে। হ্যাঁ, এটাই আমরা চাই, যেটা মানে বিশেষ করে মানে আমরা যে সিনারিওতে বা কাজ করি, গ্রামাঞ্চলে কাজ করি, সেখানে একজন বন্ধু হিসেবে যত তাদের কাছে যেতে পারবো তত তাদের আমরা শুধুমাত্র এডুকেশন নয়, বাকি সাপোর্ট গুলো আমরা করতে পারবো।
Okay, Shantanu said that through the biggest learning for GBCD was that during the pandemic, home support was provided, which brought GBCD staff not only closer to the deaf children, but also to the families. They provided not just education support, but mental support as well. And they were with the families throughout all their challenges during the pandemic. And so now the families see GBCD as their friends, not as an NGO. And this is very helpful for GBCD because they are a community-based organization working with community members. And so it brings them that much closer to the families, to the communities, creates a bond with them. Thank you.
That's great, thank you. And perhaps I could ask Bayan from Napadek the same question. So anything you'd like, yeah.
Thank you very much for the opportunity. For us in Napadek, we used home visit. This home visit helps us to meet the parents and the deaf children. And as well, we involve guidance and counseling within home-based. So why do we do this? When schools were closed, this was the time when parents stayed with their deaf children. And so they could complain that deaf were becoming more stubborn, so they changed behavior. So in this way, we target behavior change among deaf children. Then, in this home visit, we create awareness, and then we identify indicators of abuse and then behavior change among children. In the same way, we as well confirm the number of deaf children, or what I can say, it helps us to get data to know that surely we have deaf children in this family, but the deaf children may have other disability. So in this regard, we get to know the exact need of the child and help us to do the best referral to the organizations that can help. So to us as instructors, me as Bayan, when I visit a family, I become a role model. And most family members are always surprised. They even think I'm lying because I am deaf. Some will even think, for you are too smart. How comes you are deaf? So in this way, we hope that the situation will be able to change. And I hope in this home visit, we are able to capture many family members, let's say the uncle, aunt, cousins, brothers and sisters, all of them. When we meet them in a home, then awareness to the deaf is done. As well, we continue to generate data and then get the exact information from the parent, the father, or the mother. So in this, it helps us to know how we can help the deaf, the needs of the deaf, and then through home visit, we get the exact meaning of what is in a home. Thank you very much.
That's great. Thank you very much, Bayan. Do you have anything to add, Harriet, also coming from Napadek? Oh, you're on mute. You're on mute, Harriet. That's it.
Thank you so much, Bayan, for that elaborate explanation. Bayan has brought it all well. As NAPADEC, the positive thing that we learned from the lockdown that has helped us and we are still continuing with was through the parent support group, we were able to do parenting and life skills training together, joining hands. As Diane was saying that as they were complaining that they had time with their children. The parents had time with their children, and then it was easier for us when we do it at family level, training sign language at family level. It's very easy to capture the community around, especially the neighboring community. And also it helps us to assess the situation, the safeguarding issue of the children. So the safeguarding issue became very easy for us as a NAPADEC. And then also another thing, what we learned also, which was positive, is that during the lockdown, the children also were able to interact with the other people, like learning skills, like let's say vocation and then short courses that would help them. And then those one who could not go back to school, who had maybe had grown their classes, but they can learn like tailoring, bakery, and something that can help them sustain some income. We are really enrolled, and then they are continuing with, and then this has helped the youth, especially the youth deaf. It has helped them so much. Much as the negative part of it is when the children, when they started earning something little, they refuse to go back to school. They feel like, oh, I have arrived, I have got something to do. Thank you so much.
Thank you very much, Harriet. Maybe Selina, could I go to you now? Thank you.
Thank you. Hello, everyone. For Nzeve, what was positive that came out of it was that because we had to form the WhatsApp groups to keep in touch with families that are spread across the province, one of the positives of that was that parents would share videos of what they're doing with their children at home. They received the home materials, and so they would video their children as feedback. And we found this encouraged other parents who were a bit shy, who had less confidence, to also do work with their children at home. They saw what others were doing on their own, and they were encouraged by it. We also found the group strengthened the parent support, being able to share challenges during the pandemic, being able to talk about what their concerns were. Because they weren't coming to the center every day, it meant they were more open, asking a lot more questions about how do I help my child do this? And so they were able to get that assistance. The other thing is that with the home packs that we were sharing, with the reading books and all the various resources, within families, it gave access to other family members. It meant that they could share the resources. So the deaf child who's usually left out is suddenly the star of the family because they've got this lovely reading book that perhaps the other family members don't have. So we felt it just brought the whole learning for the deaf child experience. It brought more family involvement in there as well.
Thank you very much. The family involvement sounds to be quite an important theme, which of course it was in the pandemic as well, but to be able to continue that sounds very positive experience for you all. And Sangamitra, last but not least.
Thank you, Joanna. So I'm Shanghamitra Datta, representing Cine Child Aid Institute. So the main learning that we have got from this pandemic that it may happen anytime. So we have to keep ourselves prepared. We have to keep ourselves prepared. We have to keep a support plan ready for the DYPs, and we have to keep the DYPs, the parents, the community, the school teachers ready for anything like this. So what we have planned during the pandemic, what we have done is that when it was a strict lockdown, there was only online education, and those who had the smartphones and the internet connectivity, they could only access it. It was not much because although they had the smartphones, because it was only one smartphone and maybe 3 or 4 siblings wanting to use that. And not only the online education, we had to continuously provide them ISL support also. So it was a routine that we followed. And when the lockdown was not so stringent, some travel was allowed, we supported a blended approach of education where we opened the learning centers also. And the children, they loved to come to the learning centers because of the socialization. You know, during strict lockdown, the devices who are in the transitional age right now, it was very difficult for them. It was very actually not very good for them to be with the parents without their friends. And it was on isolation, forced isolation that was on them. So they could not communicate with their friends, could not socialize with their friends. So when they came to the learning center, it was a very good experience for them. And the pandemic also gave us the opportunity. We did the home visits of the students who could not come to the centers during this phase. So it was a very good relationship that we established with the families, with the stakeholders, other stakeholders. We even started, and then we started bridging the gap between the school teachers and the DYPs and the families. The schools were closed, but we started bridging that gap. We started to provide support to the children to do the worksheets that has been provided through the schools. So that was another support that we started during that time. So now we have one learning we have to take forward, that we have to develop some learning materials which are easily transferable, which are easily usable through digital media. So now we have to develop some learning materials, learning videos with sign language interpretation on education, critical concepts of education, as well as on life skill value education, because we have seen that mental health issue has been a very vital thing that affected the education and learning education. These cannot go on silo. If a child is not mentally stable, he cannot take the education. So we have to focus on that too. The life skill education, the value education, the mental health support, we have to continue to provide to the deaf children. And another resource parents group that we have really used, and we have tried to use that, and we have to develop that more, so that because they are within the communities, parents from within the communities, during lockdown also, they can support their children with education, with counseling support, with mental health support they can provide. So we have to work on that. This is one learning we have we are taking. And another is that the deaf peer groups, peer teaching, it is of utmost important. All has experienced learning loss. They have forgotten their lessons of the present class also. But among them also, there are some students who can remember the learning and some students who have fallen behind. So they can support within their communities. So this peer support thing we have to promote more to avoid such situations, such learning loss situations in future. So the main thing is that to continue the support, we have to develop different groups, different resource groups and different resources which can be provided to them with proper Indian Sign Language interpretation. And also there should be capacity building, more capacity building in terms of staff, in terms of school teachers, who can actually, after now the schools in India has reopened, again closed for summer break. So when they return to the schools, at least in an inclusive classroom situation, the teachers can support them. We have to provide that training now. So that is that is an area where a huge gap has again caused. So we have to work on all these things so that the learning continues.
Thank you very much. Thank you very much, Sangamitra. I think, I hear all of you saying that, you've strengthened relationships with families and that needs to be really maintained and built on. I know for those of you we've worked, Deaf Child Worldwide has worked with, I know working with parents is always very important, but I think we've gone an extra step during the pandemic because of the importance of this. Now, I should say we've got a few really interesting questions, and we're not going to have time to ask you all to respond to all of them, and we're not going to have time to look at all of them in the panel discussion, but I'm going to suggest to our facilitators in the breakout rooms that after we've perhaps discussed one or two of the questions from our participants, that you spent time in the breakout rooms, maybe addressing those that we haven't managed to cover as the panel. So I hope that's okay. We have a short time, but let's have a go. One more question, and I'll probably just ask a couple of you to answer this if that's okay. There is a question, and it came up a lot in the presentations about young people dropping out of school, and this was for a variety of reasons. It was sort of early marriage, it was for economic reasons, and one of the questions is asking in situations where deaf children moved into work during the pandemic, or perhaps just dropped out of school, did you have or have you had any success in convincing them or their families to return to education? And I wonder if Shampa is there translating for Santanu, I wonder if Santanu could answer that question. So any success in helping children who dropped out go back into education?
Santanu, go ahead.
হ্যাঁ দিদি, এরকম কিছু জন ছিল যারা সেই সময় ফ্যামিলিকে সাপোর্ট করার জন্য বা কাজ করার জন্য এরকম গিয়েছিল। তো তারপরে আবার তারা পড়াশোনায় রিটার্ন এসছে, বিশেষ করে যখন সব আস্তে আস্তে সবকিছু ওপেন হয় এবং পরীক্ষার জন্য বিশেষ করে আর কি মাধ্যমিক বা উচ্চ মাধ্যমিক যেগুলো মানে বোর্ড লেভেলের পরীক্ষার জন্য অনেকেই ফিরে এসেছিল। এরকম অনেকজনকেই দেখা গেছে যে তারা এর মধ্যে জয়েন করেছে এবং তাদেরকে আমরা কন্টিনিউ সাপোর্ট করেছি। এবং কিছু জন দেখা গেছে যে ফ্যামিলির অসুবিধার জন্য এরকম ঘটনা ঘটেছে। যেমন আমাদের একটি বাচ্চা ঘটনা বলি, আশরাফুল হোসেন, শেখ আশরাফুল, তার ফ্যামিলির একমাত্র আর্নিং মেম্বার ছিল তার বাবা। তার বাবা মারা যাওয়ার পর তার মা, অসুস্থ মা, এবং তার একজন বিবাহযোগ্য মানে তার বোন ছিল। তো তাকে সেই ফ্যামিলিকে সাপোর্ট করার জন্য তাকে পড়াশোনা ছাড়তে হয়েছে। এরকম একটি কেস মানে আমাদের সামনে এসেছিল। বাকি অনেকে মাঝখানে ফ্যামিলিকে সাপোর্ট করার জন্য অনেকে, বিশেষ করে এখানে এগ্রিকালচারের যে কাজ হয় যেগুলো মাঠের কাজ, সেইখানে তো অনেকেই চলে গিয়েছিল, কিন্তু আবার তারা ফিরে এসেছে পড়াশোনার মধ্যে, গিয়ে তারা কন্টিনিউ করছে।
ঠিক আছে। So there were several students who during the pandemic did drop out of studies so that they could work and earn income to supplement the family income. This might have been agricultural work or other sorts of work, but GBCD has found that once things started opening up again, schools started opening up again, these children did return back to their education, especially those who were taking their board exams. And so GBCD stepped in again and continued supporting them to prepare for the exams. An example was given, though, of one particular boy whose father used to be the income earner. He passed away during the pandemic, and this boy was left with his mother, who was unwell, a sister of marriageable age. And so this boy left education and has continued to work because he is the only one who will be able to support the family economically. But overall, GBCD have found that students who left their education in between have returned to their studies once again. Thank you.
Right, thank you. That's very encouraging to hear, Santanu. I just wondered, I'm not going to ask everyone this question, but dropout, and particularly dropout of girls, came up quite a lot in the Uganda presentation. And I just wonder, maybe Harriet and Bayan, are you having any successes encouraging young people who've dropped out to go back to school or encouraging their parents?
Thank you so much. As NAPADEC, we did a lot of campaign for back to school. First of all, we did a follow-up through the instructors and then the parent support group to find out the children who have not yet turned back to school. But before people return to school, we made a campaign and information to tell the deaf children that people are going back to school. Let's prepare for going back to school. So we prepared their mind for going back to school. Then we assessed the situation. Why are this one not going back to school? And when we assess the situation of those one who have not gone back to school, we find out the reasons for them not returning back to school. And we encourage them to go back to school. A case in scenario, we had a boy who wanted to go back to school, but the parent wanted her. He wanted him to do vocation, but he said, me, I want secondary education. So what the boy had to do is to go and look for some work somewhere where they were giving him casual labor wages. And then in return, he came back to school and NAPADEC and said, I want to go back to school. So we had to intervene to talk to the parents and see through their parent support group how they could support the boy to go back to school. As we talk now, the boy is back to school and is very happy. He's in senior 3. Then also, through the parent support group, we encourage them to do income generating activities where in return it helps them to pay and cater for school fees. A case in scenario in one of our districts where we work in, they wrote a government program and they got 5 million where they bought a tailoring machine. In this tailoring machine, people who got it hard to go back to school, like they were lacking scholastic material, they could borrow money from their support group to facilitate going back to school. So actually, as NAPADEC, we are trying so hard to make sure that we follow up that children go back to school. We make it like a safeguarding issue to all parents, and during our training, we encourage them so much, and during off visit. Thank you. Maybe Bian can add something.
Okay, thank you very much. During the home visit, I always train parents and then the family members in basic communication. So with this, it improves communication between the deaf and then the parent. And as well, we counsel deaf children for behavioral change as well as the parents. So to the deaf who think, some parents think deaf people cannot, maybe they cannot learn. Some families think they are wasting money supporting these children. Some just leave these deaf children at home. So when there is such a negative attitude within the family, home visit always works better. And when I reach there, the fact that I am deaf, these people are always amazed. So the support always comes that way. And there are some families which I see now, their deaf children have gone back to school through this continued interaction.
Yeah, that's really encouraging. I know it's an ongoing issue, isn't it? We'll just have time for one more question, which I'm going to ask Sangamitra and Selina to perhaps answer. This is about children when they're returning to school, and the question is where children are returning to school with significant gaps in learning or loss of learning as well as language. Is there any particular advice that you give to teachers to help boost their language and learning? Maybe Sangamitra, if you could give us your thoughts on that, and then Selina.
Yes. Yes, when the schools reopened after 2 long years, so firstly, it was a challenge to bring back all the children to schools. Now, when the children are coming to schools, in a classroom, maybe there are 45 children, and maybe among them there is only 1 or 2 deaf children, and the rest are hearing children. Now all are coming with learning gaps. So now the teachers, they have, and since the schools were closed for 2 years, we could not train the school teachers also on language, on Indian Sign Language, ISO. So there has, and without any practice, the teachers have also forgotten. The peers of the deaf children have also forgotten, and the deaf children themselves have also forgotten the ISO. So there has been a huge communication gap also, which is coupled with the learning gap. So there was a double challenge for the teacher and for the deaf child to communicate within the classroom. So, and take part effectively in classroom transactions. So what we have started, only we have got 2 months when the schools were opened. So we have again started the training to the school teachers on communication, and also we have taken the adapted lessons and the deaf-friendly teaching learning materials. Now we are providing them to the school teachers. We are training the teachers on these so that they can use them. So now we have just started bridging that gap, supporting the school teachers, and we have a long way to go. Now again the schools are closed now, and which will open from 15th June. So there is again a 1.5 months gap in West Bengal schools. So now over phone we are supporting the teachers, they are supporting the students, the deaf children. So again we have to start it from scratch when the schools again reopen.
Yeah. Thank you. Thank you very much, Sangamitra. And Selina, the last word to you.
Okay, sorry, I missed your question because I lost connection.
Okay, well, the question is about children who are returning to school, really, with significant gaps in their learning and loss of learning, as well as language gaps. And what is there any particular advice that you have given or would want to give to teachers to help them to boost the language learning of the young people and children?
Okay. Well, I think the biggest advice is to be patient with the children and understand that it is difficult for them. And even the difficulties with deafness for our children, they're so young and they're still learning the language. So when there was the lockdown and all, it was so easy for them to lose that language. So for teachers, really, it's patience and just understanding where the child is coming from. Also, again, connecting with the families to understand what was going on there, because situations in the home can also affect their language development. There's a lot of stress and strain in the home. They don't understand what's going on. So I think the biggest tip I can give is be patient, be understanding, and help the children relax and understand it's not their fault they lost the language.
Yeah. That's great advice. And thank you all so much. I mean, I think we've all learned a lot from all of you this morning. I think we could talk about this all day. I know it's far too short, but thank you so much for participating in the panel. And I think as I said earlier, I think what this demonstrates also is the huge importance of your organizations and others like you, who've really kept going and kept that contact with the deaf children and their families. And I think, huge vote of thanks to all of you. We are going to split very briefly, just for a few minutes, into 2 breakout rooms. And hopefully you'll be able to talk a little bit about, I apologize to those who've asked questions that we haven't had time to answer here, but hopefully there'll be time to just talk about those in 2 smaller groups. So you will see a notification on your screen in a minute, and if you just press join, you'll find yourself in a slightly smaller group where I hope everyone can switch on their cameras and have a bit more of a interactive discussion. Hello, welcome back, everybody. I don't think you had time to do more than introduce yourselves, probably. So I'm afraid we've only had a very, very short breakout group, partly because we ran over a little bit on the panel discussion. But what I would say is that anybody who's interested in continuing the discussion, please let us know in your feedback, and we can see if we can organise something to have a little bit longer discussion. But we do have only a limited time, I'm afraid, today, so I do apologise for very short very short breakout rooms today, because it's really just a chance for me to now thank you all for coming. I hope you've found it helpful and instructive. And if you want to learn more, please do have a look at our website and look at some of our training that's coming up in June and also in September. It's free, and it's specifically for those of you working with deaf children, young people and their families, particularly in sort of low and middle income settings. So please do follow up and join us for some of those if you can. We'll send you more details in a follow-up email. We're about to sort of leave shortly, but we want to just also ask you if you wouldn't mind putting your views on a very short poll, which will come up on the screen in a minute. That just gives us a quick snapshot of what you felt about the whole webinar. We will send you a more detailed evaluation in our follow-up email, and we'd really value your feedback, including any thoughts on how you would like to continue this discussion, because obviously an hour and a half is very limited, and we're always keen to look at how we can develop more of a sort of community to discuss these issues. So your thoughts on that would be very welcome as well. So I just want to thank you all for joining. I want to particularly thank all those who put the videos together and all the speakers on the videos, and particularly to our panel members. I really appreciate your time and your insights, and thank you all very much. And I hope to hear from you and see you all again soon.